Should you take calcium supplements? Okay, so the answer might surprise you. This video is for you if you're a woman, I'm now saying over 45 and in the pause phase, perimenopause, menopause, and beyond. This video is for you. I want you to listen closely. I am Robin-Nutritionist, and I work with women over the age of 40, 45 to help you get your nutrition in order, as well as helping you to mitigate symptoms, concerns related to the pause, perimenopause, postmenopause, and perimenopause, right? So that is what I do. And today we're going to talk about calcium supplements. Sometimes it's really confusing as what to take, what to not take, and what does it do to the body. So I'm going to give you this information, and I want you to always, if you don't know me, I'm a lady on YouTube. I want you to do your research, but I want to give you the information so that it opens up your mind. So let me answer the question really quickly. Should you be taking calcium supplements? I want to talk about the risk versus the rewards in that. We're also going to talk about dietary calcium, how to strengthen the bones, and what supplements you really do need to consider taking for your bone health. Because this is what it's all about. As we age, our bone mass declines. The older we get, the more likely we are for fractures and osteoporosis and osteopenia and all of those things. And if you think about it, that is happening at a high rate for women, but women have been taking calcium supplements and being recommended that. If your doctor recommends that you take calcium supplements, hey, you really have to have that discussion with him or her, because maybe you have a calcium deficiency or something else going on that they have the reason or rationale to invite you to take the supplement. But research shows and questions the effectiveness of taking calcium supplements as a supplement, but we do need calcium. To be clear, we need dietary calcium. So I want to tell you and make sure you understand where you can get your calcium from food wise. So with the supplements, let's talk risk versus reward. And this is research now, so you can look it up yourself. The risk, potentially when you're taking calcium supplement, you're taking the calcium supplement and it goes into your bloodstream really fast, and it has potential to deposit in your arteries and soft tissue in your body, potentially leading to cardiovascular disease. You don't want that, right? You're taking calcium to strengthen your bones, not to create some other issue. So when it's as a supplement, goes into your body and can deposit into your arteries. You've heard of calcification of your arteries. We don't want that. It also could lead to kidney stones. So you're taking this calcium, it's coming out through your urine and potentially can cause kidney stones. So I always want you to vet this information and anybody's information. So that's the risk. And then the reward, then, however, there is no concrete evidence that it actually strengthens our bones, the supplement. So dietary calcium is important. So eating your calcium, when you take a supplement versus eating calcium-rich foods, it behaves differently in the body. So when we're eating calcium-rich foods, it goes into our body slowly and does better for us overall. These supplements, a rush of the calcium, and then it goes potentially willy-nilly. So if you're eating calcium-rich foods, which I recommend wholeheartedly, I'm going to give you a list. So almonds, and this isn't an exhaustive list. So almonds, sardines, kale, yogurt, mineral water, tofu. Those are calcium-rich foods. I also created a whole meal plan for us women in midlife where I list all the foods that are rich in all the vitamin and minerals that you need. So dietary calcium is what you want to go for. And then if you're looking at strengthening the bones, then that is weight bearing exercises or movement, dancing, gardening, walking. And of course, I said weight-bearing exercises. So to strengthen our bones, and there's two more things you have to know. So to strengthen our bones is the calcium dietary, the activity that you're doing, exercise. And then, and if you've heard my videos before, you want to consider, you want to get your hormones checked and consider replacement therapy. Consider, it may not be for you. Honestly, it may not be for you. There are hormone replacement therapies and there's alternatives. We get into that extensively within the Necessary Nutrition community. So if you're looking at, because our estrogen is declining, and that is part of what's happening and leading to all these bone challenges. And so if we're able to mitigate that way, that is something to consider, right? And then lastly, it is widely known that vitamin D is necessary along with K2. So hear me out. Vitamin D is necessary to work with the dietary calcium that's in your body and get it to your bones and your teeth. Vitamin D is what we really do need, and evidence shows that, to help strengthen our bones and our heart. Best taken with K2. K2, and we can find K2 in food, but when it comes to the supplement, you're wanting to take vitamin D, so not the calcium supplement, vitamin D, D3 with K2. And that K helps, it's a conductor. It helps to get the dietary calcium that's in your blood and put it in your bones where we need it and in our teeth and away from the arteries and places that it doesn't need to be. And I'm always going to tell you, do your research. But I am recommending, if you know me, then you know me, that you have your D3 plus K2. And I have it linked in the down bar so that you can grab it right away. You would not take D3 K2 as a supplement if you are on blood thinning medication, because it could interact with that, or if you're on dialysis, you want to talk with your provider. So now, if your provider is asking and recommending calcium supplements, just ask the question, what is the risk versus the reward? Why are you recommending this for me? And what are the alternatives? With medicine and doctors, we need them. We love them. I'm telling you, if you have an infection, don't go get some broccoli. Like, go get you an antibiotic, right? But doctors don't study nutrition. That's not what they're studying. And sometimes old ideas in medicine take a while to catch up, right? So I'm planning that question for you to ask, and I want you to do your research. I know what I know. I do not recommend any calcium supplementation to my customers or clients, but I want you to do your research so you can find out what's best for you. So I'm repeating, what you want to have is your vitamin D. Vitamin D is in the sun, but that's not where we are most of the time. And if you have darker skin, we're not even getting it effectively and efficiently anyway. So that's the supplementation that is widely recommended, is your D3 with your K2. And then you might say, well, how much? And all of that good stuff. And on this channel, you'll find videos about how much vitamin D you should take and more. So I'm asking you to like, subscribe, comment, share this video, and I will always share information that I believe that is impactful to you. And the questions that come up in the comments, I like to answer them. And if and when applicable, I will do a video on it. So that's all I have to say about that. Check in the down bar for information on getting your D3 K2, specifically the Necessary Nutrition D3 K2. And also, if you want to go a little bit deeper, I always have free classes going on where we dig into topics that are valuable for you in a deeper level, where you can take notes, it's longer, and always wanting to make sure your nutrition foundation is up to par and you do not have disruptions when it comes to peri, post, menopause. That's my lot in life at this time. And so hope to see you more. Again, like, subscribe, share, comment. Let me know what you think. All right. Peace and blessings. This is Robin, nutritionist. There's a fly in here from Necessary Nutrition. Peace and blessings. Eat well, think well, and be well. I'll talk to you soon. Bye-bye.